Thank you, Mr. Chairman, and I want to thank you and Ranking Member Pallone for your work on this important bill, the Lower Cost, More Transparency Act, and thank you for including my bill to increase data transparency for supplemental benefits under Medicare Advantage. Every fall, millions of seniors sit at their kitchen table and flip through a stack of Medicare Advantage brochures, each one promising different supplemental benefits. In Virginia alone, seniors can choose from 143 Medicare Advantage plans. These plans are sold with promises of benefits ranging from dental, vision, and hearing to even gym membership and grocery cards. But we can't tell our seniors how much of that promise has actually been delivered to them and at what cost. In 2025, MedPAC found that Medicare paid MA plans nearly $86 billion in rebates to fund these supplemental benefits, yet the agency had no reliable data on how many seniors actually use them or their real value. Seniors are making enrollment decisions based on these supplemental benefits with no certainty whether the plan that looks best on paper will actually deliver what they need when they need it the most. At the same time, Medicare Advantage beneficiaries, who now make up more than half of all Medicare beneficiaries, are navigating rising costs and a mountain of prior authorizations, putting prescriptions and treatments out of reach. Seniors need adequate information about benefits, not more obstacles to receiving the care they need. And my bill, which is now included in this one, would require MA plans to disclose exactly which supplemental benefits are offered, how seniors are utilizing them, and how much they cost. With greater transparency around Medicare Advantage supplemental benefits, seniors will be better equipped to make medical decisions amid the ongoing affordability crisis. If Medicare Advantage is going to remain the choice for more than half of America's seniors, Congress and CMS need real data to ensure that the program delivers on its promises. I'm also happy to see the committee move bipartisan legislation, the H.R. 3514, the Improving Seniors' Timely Access to Care Act, through this aims. Prior authorization, which requires health plans to approve a service before the provider could even deliver it, poses a significant barrier to timely care, particularly to women of all ages. In my district, I hear from young women who wait weeks for cervical cancer screenings to be approved, mothers who are denied hypertension medication mid-pregnancy, and older women who are denied osteoporosis treatment until after a preventable fracture. I hear the same frustration from providers in hospitals who watch a 15-minute prior authorization request balloon into hours of paperwork, phone calls, and appeals. Medicare Advantage, a type of Medicare plan that contracts with the private insurers to deliver care, is responsible for an overwhelming majority of prior authorization requests, with nearly 53 million in 2024, compared to just 600,000 in traditional Medicare. The Improving Seniors' Timely Access to Care portion of this bill will require these plans to adopt standardized electronic prior authorization systems to expedite the processing of these requests so that providers can focus where they need to, on patients, not paperwork. And while the bill modernizes the prior authorization process for Medicare Advantage plans specifically, this is only the start, because women deserve the same efficiency no matter where they get their health care coverage and no matter how old they are. So I'm proud to co-sponsor that portion of the bill as well, and I look forward to working with the committee on getting the full bill through the floor. And with that, I yield back.